So related specifically to children, one of the top questions is, my kid's acting weird. Is it drugs?
Kids act weird for many reasons.
Yes, they do.
And what is weird? I live in Tucson, and so we often say, keep Tucson weird. I think there's a few different cities in the U.S. that do that. But really, I think, figuring out what weird means to you, what is the behavioral change? And again, like we were saying, having a conversation that's more observational, fact-based can be more helpful. There can be many, many reasons that a young person may be acting differently. There's also other mental health disorders that show up around that same age that addiction will rear its head. And so we often see co-occurring presentations. So a condition like schizophrenia, a person may be developing schizophrenia in that prodromal period. They start to have these unexpected experiences, right? Like they might be hearing something or seeing what are called visions, or we call them visual hallucinations. They might start to have some of those odd experiences. They might be having increase in anxiety or having depression. And that could be a reason they might use. It may be that they're not really using something, but they're looking weird to a loved one because they're having these different experiences. And then being a teenager is hard in the world.
It is.
So you could just be weird because you're a teenager who's trying to develop your self-identity. I think that's where, for family members, instead of jumping to the conclusion of like, this is substances, or this is, a different condition, or these are your bad friends, to really just point out the behaviors you're seeing and say, I'm noticing X, Y, and Z. Help me understand what's going on. I really want to try and understand. And approaching it with that curiosity and understanding is just an easier way in. And then you'll get the answer if they're using or not.
I'm hoping you say this like 10 more times during this podcast, because every time I hear it, I'm thinking, oh yeah. Because if you're not taught that, it's not the first thing. It's like, what the hell's wrong with you? What are you doing? Well, we know where that's going to lead. So what'd you learn in school today? Nothing. Yeah.
And I think that's the part that I feel very, very strongly about, that as much as there's clinicians like myself out in the world doing this work, that we do need to bring mental health recovery into our communities. It has to happen at the community level with our families, how we raise our children, really starting to educate them in the emotion words, understanding their feelings, because then they might be able to come up to you and say, I feel really frustrated, right? I feel angry. I feel sad. I feel disappointed, rather than not having those words and saying, what I feel doesn't seem normal, and then wanting to self-medicate.
And that everything that isn't positive, happy, on the happy side of the spectrum is bad, because we need the full spectrum of feelings.
Yeah. I mean, the pursuit of happiness is great in some ways, but, really talking more about contentment and that life is full spectrum. Frustration is part of life. Let me say it's essential to life, because if you don't face a level of hardship, frustration, difficulty as you're growing up, you're actually not going to know how to overcome it when you're an adult.
Yes.
So it really feeds into resilience, and negative experiences for children are important, because when they have a negative experience, and I don't mean to say big T trauma, but just a challenging experience is normal, so that they can have their parent, their caregiver around to show them how to navigate it. Nobody's given a blueprint of how to live life. If we teach our kids how to say their ABCs, we also need to teach them how to deal with frustration, name frustration, so that they understand how it feels in the body, which is why kids, when they're growing up, will say, I have a tummy ache. Right? They
Anxious,
know that
nervous.
they're not feeling okay.
Right.
They'll tell you it's a tummy ache. That's the most basic level of emotional awareness. And then developing words for it, being able to conceptualize it, have layers of emotions in oneself, having layers of emotions in other people. Those are the various levels of emotional awareness that we ideally want to develop, so we can talk about these things rather than just act them out.
And emotional awareness can be addiction prevention.
It's an antidote for sure.